Hey guys, it's Dr. Hobbins. It's a beautiful late September day. It's nice and sunny, it's hot. So I figured it'd be a good day to come out and do another walk and talk. I grew up in Minnesota, so usually late September, like we sometimes had snow on the ground at this point in time. So I'm loving the fact that it's hot and sunny today. But I wanted to do a quick video touching on a couple things. We've been open just over a year, and I just wanted to kind of share, what have I learned in a year of doing direct primary care. And I'll try to boil it down to two quick points. So the first one is, I guess I didn't prepare myself, or I didn't realize how much primary care, how much medicine I can practice outside the four walls of the exam room. So we do really an incredible amount of texting, phone calls, emailing, and it's really great. It provides a ton of convenience, reassurance for our patients, just ease. I'm having video visits with people who are out of town, traveling for work, on a lunch break, you name it, and so I'm really loving the offering up the convenience for people, so they can get their care kind of like on their terms. It's at a time that's convenient for them, a place that's convenient for them. Certainly I've had to learn, okay, this type of particular question or concern needs an in-office examination. There are certain limitations with that, but this goes out to like a prospective patient who maybe, we have a lot of patients who say, or prospective patients who say, well, geez, I only see a doctor once a year. But when you stop and actually think about it, number one, is that a good idea? Do you maybe need to be seen more often or check in on things more often? And then number two, when that one time a year does come around, is it just a giant nightmare, to do it, of like sitting in a crowded, gnarly waiting room, or having to go to multiple doctors to get an answer because the first encounter was just rushed and you didn't get a straight answer, or you referred back to your primary care doctor anyways. And so I think we can almost make an argument for, even if you're a really healthy person, doesn't go to the doctor a lot, the things that we do outside the four walls of the exam room are incredibly valuable. I think it allows people to get more care, be more on top of their health, and it contributes then to prevention. And I think people are just really satisfied with it. So I love doing it. My patients love it. It allows us to keep tabs on people's health in a way that's very convenient for them. And so that's something that, if you think that would be of value to you or your family, definitely think about checking us out and enrolling in the practice. So yeah, virtual care has a ton of value, as it turns out, and it took a pandemic for a lot of us to realize it. But I just feel really fortunate to be able to offer it up really on a daily basis, and it can be as simple as a text message. And I'm getting text messages on, hey doc, here's my blood pressure reading, here's my blood sugar reading, here's what I've been eating. So we can really fine tune things. I have people adjusting their blood pressure medications on a daily basis, insulin dosages, dietary tweaks, all that stuff. So we really are able to fine tune things with it. And then other times it's just really fun stuff like, hey, wanted to let you know that we talked about stress, we talked about my focus, and I just got an A on my midterm, or that sort of thing. So telemedicine is definitely awesome. It's of value to everyone, even super healthy people. The next kind of subject is totally different, but have had now a year of experience working with a lot of patients. I've always advocated for, I'm a primary care physician, a family physician, and our program covers those needs, but you may encounter major medical expenses, And that's something that I can't always assist you with, the costs associated with a hospitalization or surgery or the need to see a specialist. So I've always advocated for my patients to have something in place to cover those costs, be it a high deductible insurance plan or a health cost sharing program. And I just want to give like a huge plug for these health cost sharing programs. They are very affordable. They really offer very comprehensive care. Many of them have no network boundaries. Many of them have lower deductibles than these plans. So some of the plans that we've worked with are Sedera, Samaritan, Medishare, Zion Health. These companies are popping up all over the place as an alternative to traditional insurance, which is super expensive, not easy to use, restricts the doctors that you see. And I do take care of patients with traditional insurance. And I'll tell you what, when I order tests for them, medications, it's just stacks upon stacks of paperwork. Oftentimes they deny it for reasons that make no sense. And we wind up finding them cheaper cash options anyways. So, and I'll again give the example of a prospective patient. They'll call our practice and say, well, I have this insurance plan, and so I don't think it'll be good for me to work with Dr. Hobbins. And my thought is, you should work with a great doctor and ditch the lousy insurance plan, kind of spin it on its head, and we can save you some money. So I'll just even share the example of my family. We're in a health cost sharing program. It has there's no network. So if a serious health issue were to arise for myself or a family member, we can go to the best of the best. We can be seen at the universities in Chicago and that sort of thing. If we have other healthcare needs that come up, we can tackle those locally here. And in our particular case, the deductible is a quarter of what I would have had to pay for traditional insurance, and the monthly premium is a third of what I would have had to pay for traditional insurance. So we feel well protected, well covered for a third of the cost. And then when we go ahead to actually use it, it's gonna cost a quarter of what the insurance would have cost us. So really would encourage families, and here's the big one, small businesses, check out these health cost sharing programs, Sedera, Samaritan, Zion. Okay, I've had people have surgery on these programs, have babies, hospitalizations, specialty care, and part of our mission is high quality, affordable care, and this really packages that all together. Going to spin off of that into what I've learned as a small business owner. So many businesses right now are struggling with, financial concerns as it relates to supply chain and costs and retaining good employees. And, I really think small business owners should consider being able to offer direct primary care, and especially in combination with a health cost sharing program. So now you have comprehensive medical care as a benefit for your employees, again, at anywhere from a quarter to a third of what the cost would be for a traditional insurance plan. So we are working with a couple of companies who are doing that, and it's actually super exciting. You should see the looks on our faces when we realize, like, this medicine is so cheap, or this x-ray is so cheap. And we talk about people who pay attention. They know their premium was super high, and now it's very doable, or their deductible was through the roof and it deterred them from getting care. So that's kind of it. I think direct primary care, the big game changer has been taking care outside the four walls of the exam room, communicating much more freely through multiple platforms like video, more frequent phone calls, emailing. It really helps keep the doctor-patient relationship on track. I just enjoy it thoroughly. I know what's going on with my patient's health, but I also know about what's going on with their life, and I think that really helps me make good good decisions, and it just really increases my enjoyment of practicing medicine. And I think my patients just love knowing those day-to-day questions that come up. Having an answer for those things at your fingertips is wonderful. And I would say to anyone who describes himself as super healthy or doesn't need to see a doctor, that like don't underestimate that this isn't something that could be really helpful. And part of what I like to do is not just focus on disease, but if I have someone who's like, look, I'm about optimal health, I want to do triathlons, or I have this high stress job, or I'm going for this next level degree, like I want to support people through kind of those kind of physical and mental feats, not just take care of people when they're sick. So that's a biggie. Number two, health cost sharing programs I think are going to become a game changer. The current system of insurance is making it hard to offer it as a benefit to employees. Families are just pouring money into these programs that don't work well. They cost a ton, the deductibles are high, the networks are limited, the waits for visits are long, and I mean, I'll just come out and say it, it's just lousy. And having on the back end to try and work with them to get medications and tests and referrals covered, it's becoming more and more restrictive. You get less and less, and you're paying more and more. These health cost sharing programs are an excellent alternative to that. They contain the costs, they expand your care options. So these are fantastic. And small business perspective, there's tons of challenges going on as business owners with costs, employee retention, that kind of thing. And being able to offer direct primary care and also, major medical coverage at a fraction of the cost that you would tend to think, I think could be a game changer, and it's going to be only more and more competitive to find and retain employees. And we've got it covered at Hobbins Medical. You got direct primary care for your daily primary care needs, urgent care needs, the day-to-day needs. But then if a larger or unexpected need should arise, like a surgery, hospitalization, need for specialty care, that's where these health sharing programs come in. So if you'd like to find out more about how that works, please reach out. We've got our webpage, it's hobbinsmedical.com. My contact information is there. My email is dr, like Dr. Dr. Hobbins at hobbinsmedical.com. Our office phone is 219-627-2465. And you can reach us that way. I'm getting hot and sweaty and out of breath walking around out here in the sunshine and heat, but I love it because it's late September in Indiana, and it's pretty awesome right now. So hope you enjoyed this walk and talk. I hope I didn't make you dizzy or blinded by the sun or disoriented. It's a beautiful day. Yeah, I got the power lines back there, but I also have all the trees and the little pond behind us, and so it's a good spot to just come out and take a little walk. I hope you will check out our webpage. Come check out the office. We do meet and greets and tours. We are still enrolling new patients. We are at over half capacity. It took us a little under a year to hit half capacity. So we hope to hit our capacity this year, and then continue to kind of spread the good word about direct primary care and encourage its growth in our area here. So thank you guys. Thanks for watching till the end. Any questions, reach out to us. Take care. Enjoy the weather. Bye-bye.